Next, let's talk about your recovery at home after kidney transplantation. You can resume driving when you're no longer taking pain medications, when you have minimal pain at the incision so that you can safely operate the controls of the car, and when you feel ready to drive. You can resume work in 2 to 8 weeks, depending on the type of work you do. We can give you more specific guidance at the time of the transplant. You can resume sexual activity in 3 to 4 weeks, and you can gradually build up all your physical activity. We want you to avoid intense workouts until you've been cleared by your transplant physician. In terms of follow-up care, this is very, very important for the health of your kidney. And at the beginning, there are frequent follow-up visits. We see people weekly for approximately 6 weeks, then every other week for 6 weeks. That gets you out to month 3. Then we see you months 4, 5, and 6, and then every other month, so month 8, 10, and 12. In the second year, we see you every 3 to 6 months, and then after that, we see you once a year. If you live very far away from Boston, we may be able to adjust the schedule by working closely with your primary nephrologist at home. It's important to remember that average clinic visits do take several hours. And regardless of where you live, we want you to follow up with your primary nephrologist who's followed you before, beginning 3 to 6 months after transplant. We call that joint care or shared care. This follow-up could begin sooner, as I mentioned, if you live very far away. And we want you to continue following up annually with your primary care physician. Now, lab tests are a very important part of following a kidney transplant, and these occur more frequently than clinic visits. They generally occur about twice as frequently, so you'll get lab tests at the time of every visit or a day or two before, and then halfway between visits. During the early period when we're seeing you every week, that halfway lab test often isn't necessary, but we'll give you more guidance on that at the time of the transplant. I want you to know as well that the lab tests do not need to be performed at Mass General. You don't need to travel to Boston for lab tests. You can go to a local center that's perhaps affiliated with Partners Healthcare or Mass General or a Quest Labs and have the labs done, and the results will be sent to us. It's also important to remember that you do need to find your own transportation to all these follow-up visits and the follow-up lab tests.
Hi, my name is Julian Mitchell, pre-kidney transplant coordinator, and I will talk to you about rehospitalization, rejection, and other risks associated with transplant. So 30 to 40% of kidney transplant recipients are hospitalized again in the first 6 months after their surgery. The risk of rehospitalization goes down over time, and there are many reasons for this, which include infection, rejection, side effects of the medications that you'll be on, and then lastly, an elective stent removal, which is usually performed as an outpatient procedure, but if there are any complications, you may be admitted. So the length that you're in the hospital depends on the problem. And as a side note, if you're ever admitted to an outside hospital, please inform Mass General within 24 hours so that we can potentially transfer you back here for treatment. Let's talk about rejection. So your body has an immune system whose goal is to protect you against bacteria, viruses, and other kinds of infections. Your immune system will always see your new kidney as foreign and will try to destroy it. This is called rejection. Transplant patients require strong medications called immunosuppressant or anti-rejection medications, and what they do is suppress the immune system and prevent this rejection from occurring. Your body will never forget that the kidney came from someone else, so your risk of rejection never goes away no matter how long you've had a kidney transplant. Typically, rejection has no symptoms. The first sign will be an elevated creatinine level, which is an abnormal test result, or protein may appear in the urine. Rejection is usually caused by failure to take your medications correctly. If you stop taking your medications, you will lose your kidney 99% of the time. It's very important. The next information are the immunosuppressant medications that you'll be on. Here at Mass General, we typically use tacrolimus, which is also known as Prograf, mycophenolate, which is known as Cellcept, and also prednisone. Please call our transplant clinic if you have any question about your medications, any difficulty filling or refilling them, or any difficulty affording your medications. Lastly, risk of infection is something that's very important to talk about. Being on immunosuppressant medications may make you more prone to certain infections like shingles or urinary tract infections. For several months after transplant, you will be given medications to prevent certain kinds of bacterial and viral infections. You can lower your risk of infection by taking common sense precautions. Good hand hygiene, including hand washing, is going to be the most important thing to keep you well. In addition, please obtain regular dental care before and after transplant and receive all your recommended vaccines, including your annual flu vaccine. After transplant, you will be given additional instructions to prevent other infections. Your risk of cancer increases with prolonged use of immunosuppressive medications. It usually does not occur until 10 or more years after the transplant is performed, and skin cancer, not the melanoma type, is the most common kind of cancer after transplant. Lymphomas are the second most common. You can prevent your risk of skin cancer by avoiding sun exposure, wearing a hat, using sunscreen, and seeing the dermatologist regularly. You should also receive your routine cancer screening as recommended: mammograms, pap smears, colonoscopies, etc. Additionally, there are other risks associated with your medications after transplant, the most common of which being GI upset, nausea and vomiting, high cholesterol, high blood pressure, and if you are diabetic, most likely your diabetes will require increased insulin after transplant. Additional risks involve a biopsy, which we would do if we suspect any kidney transplant malfunction. Your original disease may also recur in the transplanted kidney. And lastly, the kidney might not last as long due to potential rejection or other problems.
Hi, it's Dr. here again to talk about some other risks and issues you should be aware of. In addition to immunosuppressive medications, many kidney transplant patients require medications for other reasons, such as high blood pressure, abnormal cholesterol, or blood clots. Some medical problems like diabetes might get worse after transplant. If you have diabetes, you might need new or different medications after transplant. If you're taking pills, for example, you may require insulin. This is partly because of the medications we give to prevent rejection, but also because the new kidney will clear insulin from your body faster, meaning you might need more therapy to lower your blood sugar. There are psychosocial risks to transplant. Some transplant patients report depression, PTSD, generalized anxiety or anxiety about depending on others while recovering, and feelings of guilt. I have to say that while everyone's different and some patients report these symptoms, the vast majority of patients, in my experience, report less depression and less anxiety after transplant. If you are on disability, your status may be affected by receiving a kidney transplant. You should know that Medicare only covers the cost of immunosuppression for the first few years after transplant. You must always have an alternative insurance that covers anti-rejection medicines because they are very expensive. Future health problems related to the transplant may or may not be covered by your insurance carrier. It's difficult to predict what a particular health insurance carrier will do. Your status as a transplant patient may affect your ability to get medical, disability, or life insurance in the future, and denial of coverage is a possibility. If you think any of the issues on this slide are relevant to you, make sure to speak with the social worker. The goal is to feel better, despite all the risks, the medical, surgical, and psychosocial risks of transplant. When things go well after kidney transplantation, life should feel very normal. Taking your immunosuppressive medications is very important for success, but our hope is that you will be able to return to work, to school, to travel, to your life, in your family, and to all your previous activities.
To end on a happy note, there's 2 success stories with Alonzo Mourning. He had a kidney transplant from his cousin in 2003, and he played for the Miami Heat, and you can read a little bit more about his experience with kidney transplant here, as well as Sarah Hyland, who plays on Modern Family, and she had a kidney transplant at age 21 from her dad, and both were very successful and continue to be successful in their personal and professional lives.
Let's talk about Mass General's kidney transplant outcomes. First, it's important for you to know that the Scientific Registry of Transplant Recipients, the SRTR, publishes data for every kidney transplant program in the country and their patient survival every 6 months. At the time of your evaluation visit, you will receive the most recent SRTR data showing Mass General's results for adult and pediatric kidney transplant survival at 1 month and 1 year, compared with an expected survival and graft survival nationally. We can answer any questions you might have about this data at the time that we see you. I should tell you as well that this data is available online If you're confident using the computer and using the Google website, you can find it on your own. You should know that Mass General's outcomes comply with Medicare outcome requirements. Let's talk about your rights and your responsibilities. Here are your rights. Your healthcare information will be protected, and confidentiality exists for recipients and donors. The communication between the recipient candidate and the transplant center will always remain confidential. You have the right to refuse transplant at any time. You have the right to be listed for transplant at other transplant centers in this region and in other regions. You have the right to transfer your waiting time to another transplant center without losing any time at your discretion. If your transplant is performed at a hospital that is not Medicare approved, it may affect your ability to get medications paid for by Medicare after transplant. You should know that MGH is a Medicare approved transplant center. How about your responsibilities? We ask that you provide us complete and factual information about your health, that you communicate with the transplant team about changes to your health, that after transplant you take excellent care of your new kidney, that you take all medications as prescribed, that you attend all follow-up visits with doctors and nurses and obtain all necessary blood tests. It's also important that you know that it is a federal crime for any person to knowingly acquire, obtain, or transfer a kidney, any human organ, for valuable consideration. Anything of value such as cash, property, or vacations cannot be used to trade for a kidney. Successful transplantation requires partnership between you and your family and your friends, your primary physicians, and the transplant center. There are a number of resources listed here and in the packet that you've received today that will help you learn more about kidney transplantation. And of course, we're interested in any questions you have, and our nurse coordinator will be in shortly to run a question and answer session.